The FDA is now recommending emergency authorization for the Pfizer vaccine for kids ages 5 to 11. COVID vaccines and kids has been a hot topic since the start of the vaccine rollout a few months ago. We know many of you have questions. We want to hear them. Text us right now at 602-444-1212.
Yeah, we have an expert answering some of those questions. Pfizer said earlier this week that the vaccine is nearly 91% effective in preventing COVID-19 infections in elementary age students. Now that info is headed to the DC for a vote.
Well, this morning we brought in an expert to help answer your questions about what's next for the vaccine. Team 12's Jess Winters is live in Phoenix. So Jess, we've already gotten in so many great questions.
We sure have, and keep those questions rolling in. So the FDA has given its seal of approval. Now all eyes are on the CDC. They'll be meeting next week to see if they'll also approve it. And joining us live is Dr. Kirklis with Phoenix Children's to answer all of those questions you've been sending in. Good morning to you first and foremost. How are you doing?
Good, yourself?
I am doing well, thanks for asking. I'm going to read them directly from all of you off of Facebook. Joe B is asking, and I'm paraphrasing here, if kids are not at high risk for serious COVID, why should they get the vaccine?
That's a really good question. So first, it is true that the majority of children, when they do get COVID, they have a milder case, which is fortunate, but that is not always the case. We've had thousands of children requiring hospitalizations, thousands of children getting the multi-system inflammatory syndrome, which is a very serious condition. So in general, yes, they do get milder symptoms, but not all. So we do want to protect those children. Secondly, in order to end a pandemic, we need everyone to be vaccinated, not just those who have serious courses of COVID. And then we also know that children do have high viral loads of the virus, and they can spread it to more susceptible people. So it's always a good advice to have everyone vaccinated. And then you also have to think about schools. Kids have had to go to remote learning. We've had to close certain schools down, certain classrooms. Kids have had to miss school due to having COVID or had a quarantine, and a lot of that goes away when we have everyone vaccinated.
And you touched on it a little bit in your response there, but what are the cold hard facts, the cold hard statistics when it comes to children? How many nationwide have gotten COVID-19, and how many of those children have been hospitalized?
So it's quite significant. So about 1.9 million children have had COVID. We've had like 8,000, I believe, hospitalizations around the United States. And I think currently about 25% of new cases are in children. So it's still quite significant, and children are a major component of new cases.
Okay, back to the viewer questions. Joy F asked, many children already had COVID, as we just said, and many have been asymptomatic. They haven't been actually feeling it. So why would they need to get the vaccine? Because all of this talk about antibodies.
Yeah, so that remains to be seen. So the CDC's Advisory Committee on Immunization Practices will meet on November 2nd, and they'll determine whether children who've had COVID also need to have the vaccine. So it's sort of to be continued on those specific segment of children.
Okay, doctor, we really appreciate your time in answering all these questions because, as we've been saying all morning, this is just so confusing. It's tough to navigate all of this, right? And he was saying earlier that the earliest that kids could get the vaccine, ages 5 to 11, in their arm, potentially November 4th or 5th. There we go. All right, answering more of your questions later on Today in AZ. But for now, we're live in Phoenix. Jess Winters, Today in AZ. Back to you.